And I would like to remind you that we are discussing our children, not yours. We as their parents should have the choice as to whether or not our children wear masks. While every parent would choose to spare their child from ever knowing pain, sickness, or heartache, we know it isn't realistic. We can't put our kids in bubbles, so we will accept that they may get a cold, an ear infection, the flu, or COVID, and that's okay. They will be fine.
Vicki sent me a CDC study done on the efficacy of masks and ventilation in schools prior to the vaccine rollout. Their findings, and I quote, "The schools that required mask use among students was not statistically significant compared with schools where mask use was optional."
Michael Osterholm, the Director for Infectious Disease Research and Policy at the University of Minnesota said, quote, "Face cloth covering has a minimal impact in reducing the amount of virus that you inhale in and exhale out. Our kids will be wearing the cutest little mask that you can get at Target, Kohl's, or the ones that grandma sewed for them, to provide the grown-ups a mental security blanket, but little in the way of actual protection to the child."
The New England Journal of Medicine, as well as Public Health England, have both published studies stating that students in school settings do not pose a risk in the spreading of COVID-19 and have not been strong drivers in the rise of COVID-19 cases. An article published in the journal Pediatrics states that even in a childcare setting with prolonged exposure to children, risk of infection did not increase among adults.
By requiring children to wear a non-FDA approved emergency authorized mask, you are promoting the idea that the mask can prevent or treat a disease, misrepresenting the use of a mask as being intended for antimicrobial or antiviral protection, and or misrepresenting masks for use as infection prevention or reduction is a deceptive practice under the FTC.
But I've been watching some of you online, and it's very clear that you only respect the science that supports your opinions. We've been asking for the science that supports masking children. All you tell us is we're following the CDC and the state officials. Well, that's not true because it's a recommendation, not a mandate. We didn't elect you to be followers, but to be leaders. We should have known that this would happen, that the school board might fail us again. It's been happening for years. HOCO used to be a place that people wanted to live in for their schools, but not anymore.